According to the American Academy of Dermatology, about 80 million men and women in the U.S. have hereditary hair loss. It's also known as male or female pattern baldness. For men, the first sign is usually a receding hairline. For women, it's typically a widening part. Here's some hair loss fact and fiction. The American Society of Plastic Surgeons says baldness is not the result of poor circulation, vitamin deficiencies, or wearing a hat too much, excessive hat wearing. According to the group, it's also untrue that hair loss can be determined by looking at your maternal grandfather, or that 40-year-old men who haven't lost their hair will never lose it. Joining me now are Dr. Eric Bernstein and Dr. Jason Bloom with the Mainline Center for Laser Surgery. First, let's talk about your credentials. Dr. Bernstein is the director of the Mainline Center for Laser Surgery. He's a dermatologist and one of the world's leading experts in laser surgery. Thanks for being with us.
Thanks for having me.
And Dr. Bloom is a double board certified facial plastic and reconstructive surgeon. He specializes in facial plastic surgery. Thanks for being with us, Dr. Bloom.
Thanks for having me.
Dr. Bernstein, I'll start with you. So let's talk about what causes hair loss and how it may differ between men and women, or it's the same.
Well, it does differ a little bit, but men and women can get hair loss due to hormones. So the hair follicles in certain areas of our scalp, we're so lucky, the frontal areas and kind of the crown of our head have receptors in it for hormones, and that can cause the follicles to go to sleep. And when they go to sleep, the hair falls out, the follicle's tiny, and we see hair loss. But one important point is there are other causes of hair loss. And in fact, here in Philadelphia, we're pretty lucky to have one of the world's experts in hair loss, George Katsourelis, the chairman of Dermatology, University of Pennsylvania. So I think it's important, if it's not your classic frontal hair loss, to make sure there's not another cause that's treatable.
Like environmental causes? What are their
causes?
No,
there's certain skin conditions that can cause where the body's immune system attacks the hair. Alopecia areata, that people call alopecia, that just means hair loss, but that's kind of the vernacular, their common term. Lichen planopilaris. We like to get big names in dermatology so we can sound smarter than everyone else. But that's where the body's immune system attacks the hair, and you would treat that a little bit differently. But the most common form of hair loss is hormonal, and we all have a little bit of that. And women can get that too.
Right.
Hormone, female pattern hair loss.
Dr. Bloom, obviously the traditional sort of treatment is to go under the knife, but there are some newer procedures out there that spare you from that. Walk us through it.
So what the newest procedure out there is called follicular unit extraction.
Again, another big name. Right?
Exactly. But like you were saying, what we used to do is we would take from the back and make a big incision or a cut across the scalp and sew that up. Then we would take the hairs out and transplant them to the front. The problem was that you would leave the patients with a scar on the back of their head. They couldn't wear their hair in the back short. Like mine, you would see a big scar there. So now we have this follicular unit extraction. And what that means is that each of the hair follicles grows in a follicular unit, which is either one hair, two hairs, or three hairs. And we use a 1 millimeter basically punch to punch out those small units. We divide them up, and then we transfer those units into small pokes on the front of the scalp where they need it. For example, if they're recessing here, or if they need some in the crown.
Or for women who, if they are experiencing baldness, it usually happens in their part.
Exactly. Female pattern baldness we call more of a Christmas tree type pattern. Along their part, it starts to widen.
Any complications that patients need to be aware of with this kind of procedure?
Well, we put patients on antibiotics afterwards, and we have strict instructions as to how they care for the grafts and what we call the donor site in order to prevent infection and to make sure that the grafts are living and actually taking hold after their treatments.
We do have some before and after pictures that I want to pull up really quickly that show people before they had this procedure and then of course after. So it seems as though they are achieving the results that they set out to get by going under this, having this procedure done.
Exactly. I mean, each person is different, and we individualize the consult to make sure, we don't just set up the exact hairline for everyone. Somebody might want, if they're having recession in their temporal area, they might want it down 1.5 centimeters. Somebody might want more. So we work with the patients to design their hairline, and then when we use the NeoGraft procedure, it helps them achieve their goals.
Dr. Bernstein, is there a stigma with pattern baldness for men and women? Talk to us about that.
I don't think there's a stigma. I mean, I think for women it's more of a problem, I think, because we identify pretty strongly with our appearance and with our hair. And, you know, it's an individual preference, but, you know, one of the nice things about the new way of doing these transplants with the follicular unit extraction is that it looks extremely natural. In the old days, you know, they used to call it hair plugs, and you would see plugs, and if the hair starts to recede, or if it recedes around the donor area, that could be a huge problem. And people actually had a stigma surrounding that.
In terms of other treatments that may not involve, you know, transplant type procedure, what can people do?
So there's great evidence now for minoxidil, Rogaine. You know, it works. And there's a 2% and a 5%. 5% was kind of marketed to men. You have to be a little bit careful because anything you put on your head kind of does get to the rest of your face, a little eyebrow growth sometimes. And Finasteride, a pill that you can take, that men take, that can also help with hair growth. And there's good evidence that those actually work. That's the brand name of that is Propecia.
Thank you so much for your insight and, of course, new information. Really appreciate it. Dr. Eric Bernstein and Jason Bloom, thank you so much again from the Mainline Center for Laser Surgery. Coming up, driverless cars, how Pennsylvania is working to become a leader in the new technology. We'll hear from PennDOT Secretary Leslie Richards.